The scene inside Regina General Hospital last night. That man, critical care physician Dr. Jeffrey Betcher, one of the first two to get the vaccine in Saskatchewan. That province made its healthcare workers a priority group. Emergency room nurse Leah Sawatsky also shared the spotlight in getting that initial shot. Both worked directly with COVID-19 patients at that hospital. Thumbs up from Dr. Betcher on the right. He's our guest this morning, and it's a wonderful opportunity to find out about that moment and about today, how it's going. Dr. Betcher, good morning and welcome to our program.
Good morning, Heather. Thank you.
I'm just thinking, you're a part of history, sir. Has that sunk in?
Not really, actually. I didn't realize it was such a big deal until the last 12 hours or so.
And the whole country paying attention to that, what would be just a normal routine needle for most cases, but not on this particular occasion, for sure, as one of the very first. When they approached you, Dr. Betcher, to be one of the first in Saskatchewan, what was your reaction?
I was surprised, pleasantly surprised, and felt that it was really a responsibility to sort of set the example for my colleagues, but also to add an extra layer of protection for me and my patients, my family, my friends, for all those that I'm around, because it's really, we're still in the height of it, and we've got a ways to go yet, but I think this is the beginning of the end.
The beginning of the end. Yes, that message we've heard, the note of optimism from so many. Was there any degree of hesitancy at all about this new vaccine?
No, not really. The trials have all been accelerated, but there's still trials, and the science is still there. There's good science behind it, and I think it's a very important thing for everyone to do.
Tell me a little bit about, we're going to go back and look at those pictures again of you receiving your vaccination, but as that was leading up, those moments as you were perhaps having discussions with the nurse and then, well, we got a close-up of the inoculation, actually. What were you thinking about, and what were you reflecting on?
Well, I guess it was just that a sense that finally we've gotten to a point that we've been looking forward to with a lot of anticipation, and that this is just the beginning of a big campaign to try to get everyone vaccinated and to bring this whole pandemic to an end.
Anticipating, because the toll has been so great, and you would know it better than anyone in that you work closely and directly with COVID patients. How has your work and your world been affected by this virus?
Well, it's turned upside down. From my non-clinical point of view, all of the preparations, all of the meetings, all of the planning that has gone into meeting the anticipated surge. And then from the clinical point of view, looking after an entire intensive care unit full of COVID patients that are very sick, and the impact that it has on the families, and the families that really can't come and see them as they would normally, being COVID, and the whole impact. And it's not just an impact on those the patients that die and the families that have lost a loved one, but there's the long-lasting effects on those that actually don't die and survive. They still have long-term health problems that they have to face.
So you're one of those doctors who have your ward, your clinic, you've lost patients during this, have you?
Unfortunately, yes, I have to say I have.
And as you say, the family's not able to be there in those last moments. And that's been one of the most wrenching aspects for us covering it, I think, seeing how you would normally be close to a loved one at that time of life and of death, and having to be separated. Can you just, I don't know, I would imagine that those are the kinds of things that you're seeing in your mind as you're getting that shot for what may lead us out of those dire moments.
Yeah. Oh, definitely. I had those thoughts. And just thinking of this is something that we've never faced in our lifetime. certainly historically, I think there has been times of this. I think of the polio epidemic. I remember when I was in grade school having teachers that survived polio but had the long-lasting effects. I think of the Spanish flu in 1918, and just recover, just the end of the First World War, and then this worldwide epidemic coming through, and then smallpox, I think, and one that we've through vaccination have been able to eradicate, but at the time of the settlement of Canada would wipe out an entire village. 3 out of 10 people that acquired smallpox died from it. It's devastating.
Vaccination has been with us for a long time, but as you say, because of how quickly this has come to be now used, there's still a lot of questions about it. We're getting a lot of them, Dr. Betcher. Probably you are in your practice as well. But let me put some of them to you as someone who's received this needle. What did it feel like after you got the shot?
It didn't feel any different than any other vaccination that I've ever had. It wasn't any more, it was maybe less painful. I've had some flu vaccines that have caused more discomfort in my arm the day after. I didn't, maybe because the cameras were on me, I didn't actually feel it. And I don't feel it now. I'm not suffering any adverse effects at all right now.
Not even in the site or anything? I was going to ask how you're feeling this morning. Any effects at all, headache or pain at the site or anything at all?
None whatsoever.
I sound like I'm taking your history, don't I? We're playing role reversal for just a moment here, but I'm intrigued to know. So you're as if you hadn't even received it. That's really interesting because, of course, there are side effects that can be associated with this, but you're not experiencing them. And so I'm thinking of people who are watching us and haven't had a chance to meet many people who have had this vaccine. Given the degree of hesitancy and the amount of questioning that still is going on among Canadians, what do you want people to know today?
Well, I think that I'd like them to know they don't need to fear the vaccine. I think they need to trust the science behind the vaccine, know that our government, our ministries of health, Health Canada, all have various levels of protection to make sure that whatever we give to people in terms of vaccination, drugs, whatever medical treatments they get, that they've been thoroughly vetted so that they are safe. And that we don't have to fear for the harmful effects that many are worried about.
Dr. Betcher, thank you very much. We may well check back with you in 3 weeks' time when you get that second dose, but I appreciate the time with you this morning.
Well, thank you very much, Heather.